We did in the pharmacy, the need for the do follow up, especially after you don't do dog.
Yes, sure. First of all, I want to correct you in what you talk where you say people then you go to a pharmacist. First of all, not every pharmacy gets pharmacists there where they work there. And many pharmacy technicians, they pretend for be pharmacists. So it's very important for if you as a patient or customer, you are well grounded, you well educated, or at least you know it's in the go on in the ground, you for be in a position where you they ask where is the pharmacist for they get the best advice. But unfortunately not many pharmacies then available at the community pharmacy. Then so and not all pharmacies them are owned by pharmacists. Okay, then yes, so where pharmacies they're not available, that means say then job of doing follow-up, patient care can be a bit lacking. You don't see, eh? So, but you get few pharmacies that we own pharmacy. We're not necessarily they at the pharmacy, but then get trained nurses that we work there. I thought we were coming to talk about diabetes.
We come to the diabetes, but this is not just some sort of education for the public, but also inside the program, we also go for a look at City Globe Limited, we the owner. It's part of the work we do.
Now, I'm not the owner of.
What's it there about?
What is City Globe there about? City Globe, the pharmacy, the retail pharmacy was established in 2013.
Okay.
And during my postgraduate education, it just widened my horizon for include public health interventions na the pharmacy. And I mean the first way do that. I mean the first way own a community pharmacy and apply rapid diagnostic testing for prevalent diseases. So now we don't become a hub for hepatitis B screening and vaccination. Nami pharmacy na the first for introduce immunization services against hepatitis. So City Globe has contributed to the prevention of thousands of hepatitis cases in the country, and of course diagnosis of diabetes by using a simple rapid diagnostic test, and that's also they go a long way for prevent complications of the disease. So that is one aspect. And also diabetes management. On a daily basis, we see diabetic patients, screen them, monitor them blood sugar levels, see how then they respond to the drugs, advice on lifestyle modifications and all of that.
So you don't look at part of how they deal with hepatitis and diabetes. One of the key things they look at. But again, in over the years we don't operate. Look at the impact to the health sector.
With it, diabetes na a condition where they make the sugar level na the blood go up because one chemical na we body or hormone I go say where the body they produced either lacking or the body not the respond to that hormone, the insulin. So insulin is a very important hormone we're responsible for regulating with sugar level. So now we say we eat high carbohydrate food or high starchy food or high amounts of sugar. They go directly from the intestine, you go directly to the bloodstream. And the insulin is being produced. The body sends the high sugar level. By right, in a healthy person, the insulin will be produced and make the glucose go back into the cells and be utilized by the muscles and you be utilized by the liver. But then if insulin they na the body, but the body not the respond to the action of insulin, that is insulin resistance, it will make the sugar level they up. Or if insulin not exist anymore or not be produced anymore by the pancreas, that will cause also diabetes. So these they bring us to the types of diabetes. We get about 3 to 4 types of diabetes. Type 1 diabetes is a condition in which there's high level of sugar levels due to complete destructions of the cells that were responsible for production of insulin. So now I make type 1 diabetic patients, they highly depend on insulin. While as type 2, which is the most common type of diabetes, we come on worldwide and at the highest prevalence in worldwide, in you they get insulin be produced many times. Insulin is already there in the body, but then the body not able for respond to the action of insulin, so that the cells go absorb the sugar, excess sugar in the blood. So that is called insulin resistance, as I mentioned. And there are factors that will lead to insulin resistance: poor diet, poor dietary habits, obesity, and all that. Lack of exercise, because exercise they help in what they call insulin sensitivity. When you exercise, the cells then they absorb glucose much more better in type 2 diabetics. So the type 3 can be gestational diabetes, that is diabetes with the occur in pregnancy.
Okay.
We get other types of diabetes which can be due to autoimmune diseases, diseases of the pancreas, or cancer of the pancreas.
Okay. Now, to say diabetes get age way they start person.
Age?
Yeah.
Yeah. For type 1 diabetes, yes, it occur at with the younger population. It can start with the younger population. Then with type 1, the
Younger
onset,
population age range.
it not actually gets a specific age range, but before the age of 30,
Okay.
you can don't get type 1 diabetes. And the onset of type 1 diabetes is very fast, while as with type 2 diabetes, the onset is slow.
What do you mean by onset?
That is the occurrence.
Okay.
Yeah, it go occur in type 1. It can occur suddenly, while as in type 2, it will occur slowly at times. Then it affects more people above the age of 40. But now, because of westernization, because of unhealthy eating habits and obesity among young children, they are now having type 2 diabetes. So the trend is changing. In the past, type 2 diabetes is more common in people above 40 or 45 years. So NIMEC now current guidelines to even advise, say, starting from the age of 35, you for check your sugar level regularly, rather than thinking that not only after 45 you will get diabetes. And now obese children, as I mentioned, are having type 2 diabetes. Yeah.
So, because you talk about glucose and you talk about sugar, it means that diabetes for you get your body for on fat and
No. Now and because one of the symptoms of diabetes will come about, they get unexplained weight loss. So, but like type 1 diabetics then can be more thinner, because there's breakdown of the fat cells, breakdown of muscles, where they occur due to diabetes. So it not necessarily means say only obese people and you get diabetes. No, there are many factors that way, what I would say risk factors that way they contribute to diabetes. One of them, unhealthy lifestyle. You can be very thin, but you get very unhealthy lifestyle. You drink alcohol, you smoke, you eat all kind sugary foods, all kind processed carbohydrates and saturated fat. So that the prone you forget diabetes. Then if you know the exercise, you know the rest well, you stressed out, then you increase in age, all that they predispose you forget diabetes.
Okay. Now, how or within person, how person go balance all this?
Oh, good question. Yes, so that means how we dey prevent diabetes.
Yeah.
So you dey prevent. First of all, there are many studies now where they show say if you pre-diabetic, that means say your sugar level don't begin for go na the pre-diabetic level for go wey not reach it full-blown diabetes. Studies don't show say you able reverse that condition there. Okay, yet alone if you healthy and you want prevent that, especially if you get genetic risk factors. So the best you can do is eat a healthy, balanced diet. Diet where then call the Mediterranean diet is known to be one of the best diets. We include eating high fiber foods, let's say brown rice, beans, all the legumes and all the grainy products, and fish as your main protein we can eat 2 to 3 times a week. Limit red meat, eating of red meat, eating like chicken instead of red meat. Red meat should only be eaten like once a week. Then more of fruits and vegetables on a daily basis. Then low fat dairy foods, low fat milk and low fat cheese and stuff like that.
Okay. Signs and symptoms. For you, we know about diabetes and things. What are the things the way you could see, or what person could tell you, but instead we gonna say this person they don't get diabetes?
Yeah. First of all, if somebody come a checking blood sugar level, in blood sugar they above, let we say 7 on fasting, if you not eat nothing, if they're above 7, then you get all the cardinal signs and symptoms of diabetes, then you can say, yeah, this is a possibility of diabetes. Signs and symptoms like excessive urination, excessive hunger, then excessive thirst, fatigue, you get tired body, you get unexplained weight loss, blurred vision. So these are all signs and symptoms of diabetes, most common. Then also tingling sensation in the extremity, like the foot or even the hand. So these are the most common signs and symptoms. But of course, you can't base your diagnosis on clinical ground. You find for do laboratory investigation. So you do fasting blood glucose level in a lab, or you get something and called glucose tolerance test, where the patient they take an amount of glucose, then you monitor them within 2 hours.
Okay, continue for still to inside the program. In name na Dr. Manal Ghazzawl, we na CEO for City Globe Limited and a specialist pharmacist, and they are for take and give you more education about World Diabetes Day for 2024. And the time from the studio clock now 12:28, and inside the program we go and take this break. When we come back, they start to look at other aspects of the issue on diabetics proper before we look at the day. Enjoy that music the way Emerson do for inside the program. And inside the program, they continue to look at more issues. We go inside the Deputy Minister of Health 1, Professor Charles Senesi, say the solar light where the ministry don't put in a different hospital them now for help reduce the past blackout now well body sector and help for tap the challenge where people don't they complain about for long term. For Professor Charles Senesi talk this since our engagement with well body workman them, journalists and development partner them. For sake of the work where the Ministry of Health don't they do for improve the well body sector and solve the challenge them within this sector. For more on this, make we join Alhaji Jallo.
As light now one of the big challenge them, we don't they affect plenty hospital them across the country, and sometimes them plenty people don't they allege say patient they can lost their life them because of the light system. We don't they ambog now well body sector them now the country, and then can challenge the can make well body workman them can get plenty chamot with community people who say they can say them well body workman they are not can do their work fine with all them kind challenge they are with different hospital they don't they face. Make the government through the Ministry of Health be launch the Salon Healthcare Electrification project for Sise hospital them able to get 24-hour light so that well body workman them could able do their work fine. And for sake of this, make the Ministry of Health don't go pull na do hospital them where they don't give solar panel them so that well body workman them go tap the way out and they suffer but light issue and then different workplace them.
Ask where is the pharmacist for they get the best advice, but unfortunately not many pharmacies then available at the community pharmacy. Then so and not all pharmacies them are owned by pharmacists. Okay, then yes, so where pharmacies are not available, that means then job of doing follow-up, patient care can be a bit lacking. You don't see, eh? So, but you get few pharmacies that we own pharmacy, we not necessarily they at the pharmacy, but then get trained nurses that we work there. I thought we were coming to talk about diabetes.
We come to the diabetes, but
Yeah.
this is not just some